In 1849, a physician named Dr. James L. Tyson sailed from Baltimore to California's gold country and set up a medical practice in the northern mines. He kept a meticulous diary. It was published in 1850 and is now held at the Library of Congress. In it, he describes treating miners for conditions with names like mountain fever, bilious fever, and the ague. He prescribed calomel, mercuric chloride, for almost everything. He bled patients, and he had essentially no idea what was actually wrong with any of them. Not because he was incompetent, but because in 1849, germ theory didn't exist. The Plasmodium parasite wouldn't be identified for another 3 decades. The word microbe wouldn't enter medical vocabulary until February 1878, when French military surgeon Sédillot introduced it in a published treatise. Frontier doctors were diagnosing and treating diseases they couldn't understand, with names they invented, using medicines that were frequently toxic. The patients who survived often did so in spite of the treatment, not because of it. That's the story nobody tells about frontier medicine. Not the heroic doctor saving lives on the prairie. The documented record is considerably darker and considerably more instructive. First, understand who was actually practicing medicine out there. The California Trail Interpretive Center documented it directly. Until the 1860s, and in some areas long afterward, a frontier doctor was almost any man who called himself one. Several states had literally stopped certifying and licensing physicians in the early 1800s. The logic was Jacksonian. Licensing was elitist. Any man should be free to practice whatever trade he chose. The result was a frontier full of self-proclaimed doctors with zero formal training, practicing alongside genuinely educated physicians like Dr. Tyson and Dr. Israel Shipman Pelton Lord, an Illinois physician who kept a detailed diary of his 1849 California trail journey, published as a Doctor's Gold Rush Journey to California by the University of Nebraska Press. His practice journals from 1849 through 1874 are now held at the Johns Hopkins History of Medicine collection. These men were the best the frontier had, and they were working from a medical framework that was 2,000 years old and fundamentally wrong. That framework was humoral medicine. Under this system, tracing back to ancient Greek physicians, disease meant an imbalance of 4 bodily fluids: blood, phlegm, yellow bile, and black bile. Treatment meant correcting that imbalance. High fever meant too much blood, so you drained it. Constipation meant too much bile, so you purged it with calomel. There was no concept of infection, no concept of a foreign organism causing illness, no concept of the germ. The whole system was built on an idea that would dominate American medicine well into the 19th century. Every trained physician on the frontier was working inside it, and the disease names they used reflect exactly what that framework could and couldn't see. The most common was the ague. Every pioneer diary mentions it. In 1821, a period newspaper documented that 1/8 of the entire population of Indianapolis died of intermittent fevers and agues in a single year, as recorded in the Bedside Rounds Medical History Research. Iowa PBS's Frontier History Archive records that most pioneers counted on a regular bout of ague, and most believed it was caused by a poison vapor released by freshly broken sod. What was the ague, forensically? Malaria, caused by Plasmodium parasites transmitted by female Anopheles mosquitoes. The retrospective diagnosis is solid. The specific symptom pattern frontier doctors described and named maps directly onto what modern clinical medicine documents. Regular paroxysms of chills, then sweating, then high fever, then apparent recovery, then the same cycle repeating. Plasmodium vivax produces what doctors called tertian fever, a paroxysm roughly every 48 hours, named by the Romans who counted the fever day, the clear day, and the return as 3 days. Plasmodium malaria produces quartan fever, a paroxysm every 72 hours, or every 4th day by the same counting. Frontier physicians accurately observed and named both patterns. The College of Physicians of Philadelphia's Historical Archive confirms that doctors in the 1830s used terms like tertian, quartan, and intermittent fever precisely because the cycling periodicity was the most obvious clinical feature of the disease. The miasma theory wasn't completely random. Disturbing prairie wetlands and breaking sod did correlate with ague outbreaks. The mechanism was real. Digging and plowing created standing water, which created an Ophelis breeding habitat. The causal chain was there. Frontier doctors were just identifying the wrong link in it. They saw the disturbed earth. They couldn't see the mosquitoes breeding in the water, pooling behind it. Here is the part that I keep coming back to. The treatment frontier doctors used for ague was quinine, derived from cinchona bark. And quinine actually works. It is a genuine anti-malarial compound that attacks the Plasmodium parasite directly. By 1860, the doctor at Fort Laramie was prescribing quinine for ague, documented by the end of the Oregon Trail historical site. These physicians were prescribing the right drug for the right disease while believing a completely wrong explanation for how either the disease or the treatment worked. They got the right answer through entirely wrong reasoning. For the diseases where they didn't accidentally land on a working treatment, the story is different, and milk sickness is that story. In the early 1800s, a disease appeared on the Midwestern frontier that was unknown on the eastern coast and recorded nowhere else in the world. Symptoms came on 3 to 10 days after exposure: vomiting, abdominal pain, severe constipation, progressive weakness, then stupor, then coma, then frequent death. Wikipedia's milk sickness entry, drawing on multiple primary sources, documents one of the most characteristic clinical features: an offensive odor on the patient's breath that physicians later determined was acetone, a byproduct of the severe metabolic disruption the toxin was causing. At the time, nobody knew what it meant. The most documented victim, Nancy Hanks Lincoln. Abraham Lincoln's mother died of milk sickness on October 5, 1818, at age 34, at Little Pigeon Creek Settlement in Spencer County, Indiana. She had gone to help care for sick neighbors who had the same illness, Elizabeth and Thomas Sparrow, who died weeks before her. Abraham was 9 years old. The NPS Lincoln Boyhood National Memorial Site documents it. Within 2 weeks of first symptoms, she was dead. Thomas Lincoln subsequently moved the family to Illinois, specifically to escape the endemic disease. The cause was trematol, a fat-soluble toxin produced by white snake root Agaritina altissima, a small plant with disc-shaped leaves and fuzzy white flowers common across the Midwest. When cattle ate the plant, the toxin concentrated in their fat and milk. Humans who drank contaminated milk or ate contaminated dairy got trematol poisoning. The disease was real, the deaths were real, and formal medicine had no idea what was causing it. The person who identified the cause was not a licensed physician. In 1834, a frontier midwife named Anna Pierce Hobbs Bixby, known locally as Dr. Anna, was following her cattle through the woods in southeastern Illinois, trying to trace the source of the illness that had already killed her mother and sister-in-law. She encountered an elderly Shawnee medicine woman who showed her the white snakeroot plant. The Smithsonian Magazine documented the moment in its 2023 piece on Anna's discovery. The woman led Anna to a nearby ridge and showed her an unassuming plant with fuzzy white flowers, telling her it was what made cows sick and poisoned their milk. Anna experimented by feeding white snake root to calves. They developed milk sickness. She spent 3 years warning settlers and eradicating the plant in southeastern Illinois. None of it traveled far. In 1927, USDA chemist James F. Couch published the first formal chemical analysis of white snake root, identifying trematol as the specific toxin. That was 109 years after Nancy Lincoln's death and roughly 55 years after Anna Pierce Hobbs Bixby died in 1873, unrecognized, unacknowledged in the report, her name not appearing in Couch's paper. Her story was forgotten until historians rediscovered it in the 1960s. And now, the treatment side of frontier medicine, because this is where the forensic record gets genuinely unsettling. The two primary tools of frontier medical practice were calomel and bloodletting. Both were standard. Both were regularly harmful, and both made sense under the humoral framework, which gave doctors no way to recognize the harm they were doing. Calomel is mercuric chloride. It was prescribed for bilious complaints, constipation, fever, and virtually any condition involving the digestive system. The end of the Oregon Trail historical site documents the clinical standard. Doctors administered calomel until the patient began to drool uncontrollably. That drooling was interpreted as proof the medicine was working. In modern toxicology, uncontrolled salivation is a recognized symptom of acute mercury poisoning. Frontier doctors were poisoning patients and reading the poisoning response as therapeutic progress. The calomel was credited when patients recovered and blamed on the disease when they didn't. Bloodletting operated by the same logic. Cut the vein deep enough that blood would spurt with each heartbeat. Used for fever, infection, inflammation, essentially any serious illness. Under humoral theory, this was internally consistent. Fever meant excess blood, so remove blood. The actual effect was to weaken already sick patients, reduce blood pressure, and compromise immune function. The end of the Oregon Trail source documents it plainly. If you could survive the medical treatments available, you might survive the disease. Joseph Lister first applied antiseptic carbolic acid to a surgical wound on August 12, 1865. He published his results in The Lancet in March 1867. The response from established medicine was largely skeptical. Many surgeons refused to adopt his methods for years. Bloodletting continued to be practiced in America into the early 1900s. The frontier doctors of the 1840s and 1850s had no antiseptic framework, no germ theory, and no way to understand that their unsterilized hands and instruments were introducing the very infections killing their patients. What Dr. Tyson's diary and Dr. Lord's journals actually document is this: educated men trained in the best medical schools of their era, doing everything their framework told them was correct, and being wrong in ways they had no tools to detect. The ague was malaria. Bilious fever was a catch-all for anything involving fever and digestive distress. Cholera, typhoid, dysentery, diseases with entirely different bacterial causes that 1840s medicine couldn't distinguish because distinguishing them required knowing that different organisms caused different diseases, and nobody knew that yet. Mountain fever was most likely typhoid, or Rocky Mountain spotted fever caused by the bacterium Rickettsia rickettsii, transmitted by tick bite, not identified as a distinct disease entity until 1909. The disease names are gone because the diseases got their real names. The ague became malaria, milk sickness became trematol poisoning, bilious fever split into its actual clinical components. The framework that generated those names, 2,000 years of humoral theory, was replaced in the late 19th century, not because the doctors using it were failures, but because the science that would make the correct framework possible hadn't been done yet. Dr. Tyson's diary is available at the Library of Congress. Dr. Lord's practice journals are at Johns Hopkins. They are precise, careful records of a medical system that was wrong about almost everything it believed, written by men who were doing their genuine best inside it. Nancy Lincoln died in a one-room log cabin while 9-year-old Abraham whittled the pegs for her coffin. The cause was a plant nobody in formal medicine would correctly name for another 109 years. That's the forensic record of frontier medicine.